Hi, my name is Lorne Brown. I'm the Clinical Director of AcuBalance Wellness Center in Vancouver, British Columbia, Canada. I'm a doctor of traditional Chinese medicine and a fellow of the American Board of Oriental Reproductive Medicine, trained in the Kalish method of functional medicine and a clinical hypnotherapist. And I created the Fertility Now channel to bring fertility concepts to you in a simple way. So that's my intention, that the things I share with you will be simple and powerful and effective. A common question and concern I get when I see women in my practice is, what can I do to improve or maximize my egg quality? And the goal here is healthy baby. And so the approach or the mathematical formula for healthy baby is quite simple. We get a healthy baby when we have a healthy egg, plus a healthy sperm, plus a healthy uterine environment. And so let's talk about making a healthy embryo, which will turn into a healthy baby, but start off with maximizing the egg quality. Most of the people I see, the women that come into my practice, having a discussion about age is not of super value to them. It's important they are aware of age and fertility, but they're wanting to have a child now, and whether they found love late in your life, or whether you had a career and now you're having children, or whatever the reason is, there's nothing we can do about how many birthdays you've had. Your chronological age, we cannot do anything with. However, your biological age is something that we can work with. And so that's what I want to talk about today. Some of the things that you can do to impact the cellular environment that your follicles, which contain the eggs, mature, so they have the potential, or they have the opportunity to mature in a healthy environment so they can reach their maximum egg quality or their peak fertility potential. And so I'm going to pull up a slide here or somewhere on the screen. And, you've probably heard about the preconception care. A lot of people in the naturopathic Chinese medicine world talk about 3 to 4 months. The more accurate number is probably 100 days. And the reason being is you have all these resting follicles before you were born. And then every month, once you go through puberty, you recruit several follicles that contain eggs. And that recruitment process lasts close to a year. And it appears that the last 3 to 4 months, or those last 100 days, can really impact the quality of the egg that you'll release in a natural ovulation or in an IVF setting. And so if you're oftentimes, a woman will come to my practice and say, what do I need to do to get healthy? I just had my menstrual period. Well, that only gives you 2 weeks out of the 100 days. And so you really want to have 100 days of that healthy environment, which your follicle is going to mature in before it's released in an ovulation, the egg, or in an IVF setting. And so it takes on average about 100 days. And the analogy I want to use is nourish the soul before you plant the seed. And this comes from the Chinese medicine concept of preconception. And so if you can think of it this way: if you ever had a plant that you've neglected that looked like it was dry and brown and basically ready to be put into compost because it has withered, and instead of doing that, you water it, you add some fertilizer to it, you maybe remove it so it's not directly in sunlight, and you've been able to regain that flower, it was able to regain its vigor and give off fruits and flowers. So you did not change the roots. You didn't do donor roots here, right? That plant always had the potential to give off fruits and flowers, but because its environment, the soil, was suboptimal, the plant wasn't able to reach its peak potential to give off the fruits and flowers. And this is the analogy when it comes to egg quality. We can't really tell. We don't have great tests at the time of this recording to say what your egg quality is. And so all we get to work with is your soil, the cellular environment. So when your follicles go through that recruitment process for those 100 days, it's getting the best environment so it can reach its peak fertility potential. So hopefully you'll have maximize your egg quality at the time of conceiving naturally or through an IVF. So what are the issues with soil? If you think about it, when you're about to garden, before you put your plants or plant your seeds, You'll pull out weeds. You may do compost into the soil. If there's rocks, you'll remove it. If there's any contamination in the soil, it wasn't, used for something else, you may clear out that dirt and put in better dirt. You'll fertilize the dirt. You'll put good water on that dirt so that plant gets that right environment. It needs to have the right pH, etc. And so same thing from a cellular level. So these are the things that can affect the terrain, the soil, your cellular environment, that can either negatively or positively impact your egg quality. So here are some of the things that can negatively impact your egg quality. These are the issues around the weeds, the bad soil, not having the right nutrients in the soil to help that plant reach its potential. So from an egg quality and sperm quality, if there's hormonal imbalances, this can impact whether you reach your peak fertility potential. Think of PMS, premenstrual acne, other hormonal imbalances, irregular cycles, inflammation in the body. There's an expression called inflammaging, which means chronic systemic inflammation leads to accelerated biological aging, which can lead to premature degenerative diseases. And I often say premature fertility decline. So that's inflammaging that comes from chronic systemic inflammation. Poor diet, stress, the chemicals in your environment can all lead to inflammation in the body. You can just have nutritional deficiencies. It's very common to see people with zinc deficiencies and magnesium, selenium, vitamin D, a real easy one to correct and test for, can impact your fertility, hence your egg quality as well. Having infections, the alkalinity of the soil, of your cellular environment, whether it's too alkaline or acidic, can affect the health of the cells. Toxicity, so if you're having lots of chemicals in your environment, it's really hard at this day and age to avoid all the chemicals in our environment. So you really want to do your best to avoid the ones that you can, since we're surrounded by it. But these toxins, these chemicals act as endocrine disruptors, meaning they can impact your hormonal balances and therefore that environment in which your follicles are maturing in, so they don't get to reach their peak fertility potential. Oxidative stress, think of that as like body rust. And then poor blood flow. If you're not getting water to the plant, if you don't water the plant, it will dry out, right? And won't survive or thrive. So we want blood flow to your follicles and your reproductive system. More blood to the ovaries, then more hormones, nutrients, oxygen that get to those follicles, to those eggs. More blood to the lining, thicker, richer lining as well. So hopefully more receptive for implantation. So these are the factors that can impact your soil on a cellular level. Stress can impact blood flow indirectly. When you're under stress, your body directs the blood flow away from your reproductive system so it can go to your heart, lungs, and large muscles so you can fight or flight. And blood flow is really key for our reproductive health. As women age, the blood flow to the reproductive system declines naturally anyhow with aging. So we really want to do whatever we can to support blood flow to the reproductive system. Poor diet, you can lose nutritional value. If you're not having a good diet, it can lead to inflammation and hormonal balances as well. If you don't have good digestion, then you're not absorbing the nutrients, even if you're eating a good diet. So we want to make sure you have healthy digestion. If you have chemicals or toxins a lot in your environment, that will impact that. Think of the type of work you or your spouse does. That can impact the egg or sperm quality. If you're underweight or overweight, again, not ideal for that cellular environment, for that soil. Lifestyle, under-exercising or over-exercising, not having adequate rest, not having sufficient deep sleep. If you're a smoker, drinker, all those things will impact the soil, including age, birthdays. The only thing on this list that we can't impact is your birthdays. And so there's lots of things that you can do to impact the biological age of your body versus the chronological age. So if you're 40, chronologically, where are you biologically? Is your body behaving biologically 50 or is it behaving biologically 40? So we can't change the chronological age, but we can change the biological. Inflammation is a key one that we see in our practice, and you really want to bring that inflammation down, which I believe will impact or support your fertility. We see inflammation in patients diagnosed with endometriosis and PCOS. Just look at all the things that chronic systemic inflammation can lead to. So all the different diseases. So it's not surprising that inflammaging or chronic systemic inflammation, which leads to accelerated biological aging and premature degenerative diseases, can also impact your fertility. So it's something we really want to play on that soil level to improve your inflammation status. I just want to share an example of nourishing the soul before you plant the seed. So she's 33 years old when she came to my practice. She's never had her own cycle, been diagnosed with polycystic ovarian syndrome, and she's never had a natural cycle. She's had menstrual bleeds, but only if they were medicated through ovulation drugs or through a progesterone withdrawal medication. That's the only time she would bleed. And often even with the progesterone withdrawal, she wouldn't bleed. She'd done IVF. The first cycle, the first transfer was a negative. And unfortunately, the second transfer was a chemical pregnancy ending in a miscarriage. And she only had 3 embryos from her IVF that made it to day 5 blastocysts. And so she had 1 left, and she came to our clinic to help her with uterine receptivity so she can make sure this next one works, this last one works. And we talked about nourishing the soul before you plant the seed in the 100 days to peak fertility. And I invited her to allow us to work with her for 100 days, because if we're able to nourish her soil and pull out the weeds, change the pH of her soil, correct where there's nutritional deficiencies, tamper down that inflammation, then there's a good chance her cycle will return, because we've seen this before with women that don't ovulate, so she could conceive naturally if she wants to and keep that embryo on ice. And even so, if she starts to get her cycle back and we work on the environment for 100 days and she's not pregnant, she can still go ahead with that frozen cycle, hoping now that that soil is in a much better place at its peak potential, so it'll be more receptive for implantation. She was overweight. She had some skin issues, hirsutism, so extra hair on her body. She had some acne and experienced depression. Over the 100 days, she lost about 25 pounds without calorie counting, just our fertility diet that we have. We did acupuncture and laser with her on a regular basis, laser for fertility and acupuncture. We did dietary and lots of supplements. And she lost 25 pounds, her skin cleared up, her mood cleared up, and she said she's noticed her hirsutism had changed a little bit. So already we're seeing changes on a cellular level based on her health expression of losing weight, more energy, better mood, skin cleared up. And on that 100 days, that 4th cycle of working with her, she never had a cycle until that 4th one. So we worked with her without having her own cycle, but she conceived naturally. So as soon as we got her there, she conceived naturally and had a healthy baby. And that embryo is still on ice. So I wanted to share that as an example of nourish the soul before you plant the seed. So her recruitment, where her eggs were not even getting to ovulate because of the hormonal imbalances, through all these changes, we pulled out weeds, we watered her soil, we made sure there was good sunlight, that's our laser, all that stuff we did to optimize her soil. So her system was different and she was able to come back online, as you can say, better environment, and then start to ovulate and conceive naturally. And this was after IVF being unsuccessful for her. So just want to let you know there are things you can do naturally to support whether you're trying to conceive naturally or do an IVF. Another example of a woman playing with her soil. So she had a child, but she had secondary infertility. She was 39. She noticed her cycles become irregular. She was under a lot of stress, and her FSH was at 30 at the time. So she came to our clinic because the IVF clinic had told her that she wasn't a candidate to use her own eggs and she would need to do donor eggs based on her age and her hormonal profile of her FSH being 30. So she was open to donor eggs, but she wanted to leave no stone unturned, and she decided to give herself a year to see if she can try to conceive naturally or get her cycles back and then go into an IVF with her own eggs. That was her goal. Maybe her FSH would come down, she said. Maybe they'll take me into as a patient if they see some changes. So we worked with her, and over several months, again, that 100-day process took a little bit longer than 100 days for her. acupuncture again, dietary therapy, stress reduction tools, supplements, herbs. And her cycle came back online, her mood improved, and she conceived naturally at age 40 and gave birth to a healthy baby as well. So again, she came in at age 39, chronologically 39, she came in at, but biologically she was like in her 50s. And we can't do anything for the egg per se. That's what she's been given at birth, that potential. But we can play with the soil, which is the environment in which this follicle is going to mature in, to help it get to its maximum egg quality, to get to that peak fertility potential. So that's an example of what that is. Now, if you're really after a healthy baby, you got to have good sperm. So men are, as you can see in this slide, 1/3 of the time it's totally male factor, 1/3 of the time it's both male and female. So over 50% of the time the man is contributing to the infertility. And healthy baby equation is healthy egg plus healthy sperm plus healthy uterine environment equals a healthy baby. And still in this day and age, it's usually the women that's coming into the practice. Even when it's male factor, it's still mostly the women that come into the practice. And we now know through more research and more testing that it's often, or can often be, the sperm that leads to unexplained infertility, that leads to poor embryo development that you've seen in an IVF setting, and early miscarriages. So it's really important that the guy nourishes his soul before you plant the seed as well. The great news about men is we don't have all our sperm at birth like women have all their eggs. We're making sperm all the time, and that maturation date is about 72 to 90 days. And so if a guy's been smoking or eating poorly or around chemicals, realistically within 3 to 6 months, if we go abracadabra and everything gets cleaned up, within 3 to 6 months, there could be changes to his sperm quality as well. So I want to remind you, healthy baby, it's the healthy baby approach. So we want to help maximize the egg quality and the sperm quality, the uterine environment. And we do this by nourishing the soul before you plant the seed. At AcuBalance, we use many natural modalities, fertility acupuncture, laser for fertility, naturopathy, including herbs, supplements, and nutritional IV therapy, and my abdominal massage. And then there's all that community and exercise and the diet, all that stuff, meditation, getting out in nature. It's amazing how much this can impact your overall health on a cellular level to play with that, that soil. And so there's lots of things that you can do naturally to optimize your fertility, whether you're trying to conceive naturally or doing something, say, like IVF. I want to wish you the best of luck, and please check out some of the other lectures on fertility now. I hope I was able to give you a simplification on what you can do to maximize your egg quality. Thank you.